A great way to determine whether or not you have a knee injury is through the process of ultrasound. Here today to tell us about that, Dr. David Cooper from the Knee Center behind McDonald's along Kidder Street in Wilkes-Barre. Dr. Cooper, nice to see you again.
Nice to see you, Dave. Thank you.
So when it comes to ultrasound, this process starts with basically you invite patients into the office and you begin with an exam. Tell us how it works.
Well, in orthopedics, it's important to do a hands-on physical exam. We try to take a history from someone, how you get injured, how the knee gets injured. You can do a physical examination, but the ultrasound is a relatively new orthopedic device which allows us to look at the soft tissues, the cartilages, the ligaments, sometimes the bones. So it gives you an immediate diagnosis instead of being shipped out for an x-ray or having to get an MRI. The advantage of ultrasound is that it's non-invasive and there are no side effects. You go get an x-ray, it's radiation. You go to an MRI, there are complications from an MRI. But the diagnostic ultrasound is immediate, non-invasive, and best of all, patients can look at the screen and see their knee.
Now, doctor, you were explaining to me with ultrasound, one of the advantages is if you make this early diagnosis, this could really prevent a lot of problems down the line. So often better to act early and then save the pain later.
Well, a common complaint I get is people go elsewhere and not to say other people can't do a thorough exam, but I've been doing knees for 20 years and I feel I can pretty much tell what's going on when I see somebody. I see a lot of people who think it's a minor injury, so they don't come in for a week or 2 weeks or 3 weeks. In some injuries, you do some damage to the knee, usually not irreversible. So I always think it's a good idea if you have a pain, if you twist your knee, injure your knee, doesn't get better in a day or two, it might be a good idea to start thinking about seeing someone professionally for that.
All right, so the Knee Center, it's located right behind the McDonald's along Kidder Street in Wilkes-Barre. Pretty easy to find, and for our viewers that would like to find out more about what you have to offer, perhaps if they have knee pain and would like a consultation, how can they get in touch with you?
Easiest way is to call us, 825-KNEE, or a very nice website, thekneecenter.com. On that, we have an email, so you can leave a comment, or better yet, just email us your problem. We'll always look at it generally within 2 or 3 days and get back to you. We'll give you a phone call. We'll check on your insurance. We'll try to do everything possible to make the visit quick, simple, and painless.
And that's what everybody wants when it comes to preventing pain with the knee. Dr. David Cooper here at the Knee Center in Wilkes-Barre, thank you so much.
Thank you very much, Dave.